has helped many people over a 25-year career, and she's also been part of 2 large volunteer efforts that she's been involved with. One, the Soldiers Project, which is an amazing organization that counsels active duty soldiers and veterans and their families in ways that help them come back from the trauma of combat or serious injury, in ways that help them become whole again. And that's an important part of her volunteer work. The other part of her volunteer work is, for a long time, she's been a volunteer with the American Red Cross, and that's put her into the center of some of the most traumatic events of our time. She has spent a lot of time, did spend a lot of time in New York City after the 9/11 terrorist attacks as part of the Red Cross's effort to counsel and help people in that environment, as well as in New Orleans after Hurricane Katrina and all of the stress and trauma that took place there. So she's been in the field, and she's been part of the way healthcare professionals help others, as she'll tell you. She's also involved in a movement to change the paradigm to how mental disorders and mental stress is dealt with by the medical profession. And she'll explain that as part of her work as well. So, and the topic of her talk tonight is First Instill Hope. So please help me welcome Dr. Nadine B.
Well, I was very, very, very moved by Eleanor Longden's TED Talk when I first saw it a couple of years ago. And it affirmed for me that what she said is what I had felt for decades. And that is that people who have experienced difficult, traumatic, sometimes, experiences from childhood through war and refugee situations to being victims of violent crime, that we should not focus on diagnosis and pathology, but we should ask the stories about what has happened to you and how have you been able to survive, sometimes even thrive. And I've been inspired for decades by the people I have worked with who have survived incredible life experiences. So what I am proposing, what we are doing in our curriculum in the Master of Social Work program, is that we move away from pathology and diagnosis and first instill hope. It's a central value of the social work profession. And when I started my training 30 years ago, I remember hanging on to that phrase. And I've used it all through my practice and all through my teaching. First, instill hope. And operate from a position of not knowing. We aren't experts on the lived experiences of others. Operate from a position of curiosity. Operate from a position of what we call unconditional positive regard. So what do we put in place of pathology and diagnosis? Recovery and resiliency. It is a new paradigm for health. And let me just say that I didn't use the term mental health. I think there's false dichotomies between mental health services and physical health services. They are one and the same. It's all health. You cannot separate them. And so I'm proposing that we work much more collaboratively with the clients we see or the patients we see. Not only collaboratively with the client in figuring out goals for the work together, but collaboratively across disciplines of health. That we bring together physicians, nurses, nutritionists, public health officials and behavioral health professionals together in collaborating with an individual or a family or even a community toward recovery and resiliency, despite adversity. I think that it's a much more compassionate approach. It's respecting the strengths that a person possesses in order to have survived. If they are sitting there talking to you, whether you're a primary care physician or a nurse practitioner or a behavioral health professional or a nutritionist, if they are sitting and talking to you about their experiences, they are survivors, not victims. It's much more person-centered. And this is a movement that really has started with consumers of mental health services. And the organization NAMI, National Association of the Mentally Ill, and also other consumers, Eleanor Longden, the Hearing Voices Network, and others. And what the central message is that we need to deal with the person first. So instead of, as I heard in my training, and I've heard in halls of hospitals, the schizophrenic in room 10, it's the person who is challenged by schizophrenia. Even if upwards of, say, 30% of people who have experienced some kind of trauma, whether it's child maltreatment, including sexual abuse, combat experiences, we do know that upwards of 30% of our post 9/11 combat veterans have experienced post-traumatic stress symptoms. That means 70% did not. 70% have survived and sometimes even grown as a result of the experience. They are changed, certainly, but they are not broken. It doesn't mean that the impact of traumatic experiences, whether we're talking about violence, disaster, war, is mutually exclusive to recovery and resiliency. All can be present in the same person or family. The guiding principles of recovery come from the U.S. Substance Abuse and Mental Health Services Administration. This is a relatively new movement. The Council on Social Work Education, our accrediting body, has embraced this movement of recovery to practice. So, all right, we want to instill hope for recovery, and recovery is possible for everyone. You might think of recovery referring to substance abuse disorders, but actually it's much beyond that. And it involves moving toward a better state of well-being and health overall. The guiding principles of recovery emerges from hope. That's the first guiding principle. It's person-driven. So we work collaboratively with people who are challenged by various health disorders. It occurs via many pathways. It's not linear, it's not the same for everyone, and it occurs to different degrees. It's supported by peers and allies, and it's supported through relationship. I tell my students over and over and over again, regardless of the intervention you might be using, whether it's cognitive behavioral therapy or family systems therapy or the narrative approach, it's relationship, relationship, relationship that matters. I'd like to also share a few stories in just a second. Recovery also is supported by addressing trauma. Now, trauma has become kind of a buzzword, and I hear it and see it everywhere. It's one thing to be informed about the effects of trauma neurologically, the neuroscience of trauma. But you can become trauma obsessed, and that can become more of a pathology focus rather than a hope and recovery focus. Recovery involves individual, family, and community strengths and responsibilities. We are responsible for one another. Most of all, it's based on respect. As Howard mentioned, I've been a disaster mental health services volunteer with the American Red Cross since 9/12/2001. I, like thousands of people across the country, called the Red Cross on 9/12/2001 and said, how can I help? Little did I know the training that went into becoming an official disaster mental health services volunteer. But I went through the training in that fall, and my first deployment, baptism by fire, was up to Lower Manhattan after 9/11. I am honored to have walked beside people in incredibly distressing, devastating situations after 9/11 and after Hurricane Katrina. I brought a couple of pictures of the lower Ninth Ward in New Orleans, where virtually 100% of the houses or homes, apartments, were rendered unlivable. Either they were completely destroyed or they were not safe. And this is an area, proud history of generations and generations of home owners, starting that were shrimpers and worked in the Gulf, and primarily African American. And you can see the devastation. And I always remember, this is spring of 2006. And what I remember the first time I went down, you can see this is just the facade of a house, is that the trees were denuded, there weren't birds singing, everything seemed brown as far as I could see. And yet, I found people that had not only survived, they had hope. I became involved and was one of the founding board members of a rebuilding organization called Lower9.org, and this is one of the homes we've rebuilt. This is one of the families I met soon, the very first time I went down to volunteer. And this man, you could see with his 3 children, smiling children, they have about 150 Mardi Gras beads around their necks. You can see they're almost weighed down. Mm-hmm. Someone dropped off at this community center being run by old hippies and wannabe new hippies. That was an old, church multi-purpose room, and we served 3,000 meals a day, breakfast, lunch, and dinner, for people that were in their FEMA trailers or stuck somewhere but wanted to come home. And I also set up a children's play area, and someone dropped off a huge box of Mardi Gras beads. The kids thought it was great. But notice their smiling faces. This gentleman told me his story of staying on his rooftop for 3 days before being rescued, because with his children, his wife did not survive, because they wouldn't leave their dog. And yeah, here he was, I want to come home. And he eventually came to a new home. This is Mardi Gras beads hanging in the tree. The trees grow Mardi Gras beads during Mardi Gras season, carnival season. And in February 2006, Hurricane Katrina started out, hit August 29th, 2005. They had Mardi Gras, and it was important. Okay. What I have seen in the people that I have worked with, I started out as a child welfare worker. I went into homes and provided in-home family support and worked in the early intervention system in Baltimore County. I heard very sad stories. I really did. But from them, through the people I've worked with in disasters, I've always been awestruck by the strength and the survivorship skills that these people have. Resiliency is this ability to survive, perhaps to thrive, despite adversity. Have you heard that old saying, if it doesn't kill you, it'll make you stronger? That's basically what we're talking about here. We're talking about something relatively new in journalism called post-traumatic growth. You've noticed that earlier I did not use the term post-traumatic stress disorder. Very deliberately. Because what people are experiencing who have experienced child maltreatment, intimate partner violence, violent crime, combat, what they're experiencing are normal reactions to very abnormal situations. So there is kind of a movement to drop the D in PTSD. And to talk about the fact that many people, despite having experiences, or traumatic experiences, bounce forward. Not only just bounce back, they bounce forward. And the importance of stories. How many of you, well, let me ask all of you. If something really, really thrilling happens to you, or something really, really upsetting, what's your first inclination? What do you want to do? Talk with someone. Yeah, tell someone. Do you tell just one person? Usually? Probably not. And do you tell the story exactly the same way every time you tell it? We make meaning of our lived experiences by telling our stories. And really, that is the crux of the therapeutic relationship between client and mental health professional. I'd like to share another story with you. This is a photo of one of my former students and a very close friend. On the right. He graduated in 2013. He's now Director of Veterans Services at Portland State University. And he was an Iraq War veteran. He deployed twice. He was sitting with his brother that could virtually be his twin. They're only about 13 months apart. And his brother is older. And his brother deployed 4 times to Iraq. And this is a picture of them sitting on one of Saddam's thrones in one of the palaces that was empty, being used as a headquarters. And you can see that they seem, pretty happy. One bounced forward, one didn't. Ray has done tremendously well. And I do have permission to use this photo and to tell the story. He was married, well, he was engaged and then he got married when he came back. He was close to his mom. His brother was kind of always estranged from his family. And remember, recovery happens through the support of relationships. People most at risk for adverse effects of trauma are socially isolated. And unfortunately, his brother was. And his brother, I don't think anyone should deploy to war 4 times in 5 years. But he did. And they saw each other. He was coming in country, he was going back. And he was, and unfortunately his brother fell into despair and hopelessness and cycles of substance abuse and mental health hospitalizations, and became homeless. We couldn't even find his brother to invite to his wedding. But what accounts for these differences? They have reconnected somewhat, but unfortunately his brother is now dying of cancer. I'll just finish up with some post 9/11 stories of recovery and resiliency. These are photos from the 9/11 memorial. If you have not been yet, it's unbelievably moving. And this is the survivor tree. It's a pair outside the World Trade Center that, despite the collapse and the fires, survived and bloomed the next spring. I just wanted to share a really quick story of an inspiring story of a young man I met who had been working on Wall Street and was an amateur artist. And he came to the Red Cross Family Assistance Center. He was very clearly traumatized. And he asked for help, and I spoke with him, got to know him over a few days. And he told me the story that, you know, he was getting ready, he was in a coffee shop near the World Trade Center and getting ready to go on the floor and as a broker, and he, the first plane hit. And immediately he thought, oh my God, you know, I want to get some of my paintings. And he went up in a high rise, I forget when, it was like the 30th floor, gathered a couple of his favorite paintings, got to the elevator, was pushed it, the elevator opened, and there was a woman with 2 tiny twins in a stroller. And then the power went out, no elevator. 30 floors, 28, 30 floors. He carried them down 28 floors, and he stayed with them and got them across the Brooklyn Bridge before the collapse. He saved them. He became an artist full-time. He left Wall Street. And his paintings are incredibly, incredibly moving. So I'm calling all of you to action. Listen compassionately and attentively to stories of those you love and those you may not even know, of people who have survived. And then reframe and restory. Find meaning in their lived experiences. One of my favorite questions was, tell me, how did you survive? Who or what made a difference? So ask people their stories and ask for more integrated health services. And in closing, share stories. Share your stories. Do life review and reminiscence with older loved ones in your life. The power of narrative to understand and make meaning of our experiences and to emerge with hope is phenomenal. Thank you.